All right, how can we improve our attention? Is there a way to improve our attention? Absolutely. However, before this improvement, we have to understand the dynamics of attention. How does attention work? First of all, we started with the limited capacity of the attention. That's number one. Here we will also consider the number of factors that can influence attention. There are some factors in life influence attention positively, and there are factors in life influence attention negatively. We have to understand those factors. And after that we can talk about improvement. We will also talk about the measurement. Can we measure attention? Absolutely. In scientific studies, we do. However, let's start with the dynamics of attention. I will start with the concept of habituation. Habituation occurs when we are subjected to the same stimulus again and again, repeatedly. Eventually we get habituated to that stimulus, and that stimulus cannot affect us anymore. Let's give an example. I am in a room right now. There is a ventilation. It is not happening, there is no noise coming from the ventilation, but let's imagine in your room there is a ventilation and a noise sound coming from it, such as something like this, continuously. At first, when you enter to the room, you will hear that noise, and that noise will bother you. Eventually, when time lapses, you won't be able to hear that noise anymore because you get habituated. Your brain is helping for this procedure, and you might understand that habituation is working for us. So because of habituation, you can pay attention to something more important. For example, that noise coming from the vent is not a life-threatening stimulus. Therefore, why am I going to pay attention to that stimulus? Because what we said, remember, there is limited attention capacity. So if I use my limited attention capacity to something like this, something unimportant, what am I going to do for the rest of the day? So habituation is something that works for us. Because of habituation, we can ignore the irrelevant stimulus so that we can pay more attention to some relevant stimulus. And for example, in this cartoon, that's what we depict. This lady is able to read her book in spite of the noise coming from outside. All the yellow spots are the noise coming from the outside. Barking dog, loudly speaking man. Behind you see the noise of the train and the noise of the people coming from the tent. In spite of those noise, this lady is able to focus, concentrate on her book, thanks to habituation. Another concept I would like to mention is the object permanence. Object permanence is introduced to us by Jean Piaget, and what it basically says is awareness of the stimuli, even though the stimulus is not on site, even though we cannot see the stimulus. For instance, the classic example for this is get in front of a 5-month-old baby. Show him or her an appealing toy. The baby will follow the toy with her eyes, so showing some interest. However, when you hide the toy behind you or behind some counter, for that baby, the toy disappeared. It is gone, it doesn't exist anymore, because the baby haven't developed object permanence yet. On the other hand, according to the theory, after 6-month-old, object permanence is developed. So get a 7-month-old baby, for example, and show this appealing toy to her. Again, she will follow with her eyes, showing some interest for the toy. And when you hide the toy behind you, she will continue to follow that toy by like looking, kind of trying to reach behind you, looking behind you, and because she has the awareness that the toy doesn't disappear. The toy is still there. That we say the object permanence is developed. So from here, what we understand is that, first of all, before that, how does it develop? We have to understand there are two important cognitive components. One is short-term memory. Absolutely. Short-term memory should be developed. That's number one. So that the baby can remember the existence of the toy. And number two is attention. Even before short-term memory, attention should be present, because without attending to that stimuli, how are you going to memorize it? How are you going to remember it? So what we understand from object permanence is that we are not born with these attentional skills. We are not born with these cognitive skills. The cognitive skills are developed as we interact with the surrounding. So maybe we are born with the tools necessary to develop these cognitive skills. However, those cognitive skills will develop as we interact with the surrounding, as we socialize, in other words. So, in other words, we can say that attention requires socialization. That way, it will develop further. All right, a quick review. Usually I don't use this much writing on my slides. However, this video will be uploaded to YouTube channel. If you watch from there, you can pause and get some more information. But quickly speaking, attention is limited. We have been talking about that since the beginning. We have some relevant proofs about the limitation of attention. Let's be aware of that. We can focus on one thing at a time for 100%. Secondly, attention is selective. That's what we learn from habituation. We can selectively attend the relevant stimulus. On the other hand, we can unselect some unimportant stimulus. Third, attention is developing unit of the cognitive system. That's what we learned in object permanence. We are not born with these skills, with these abilities. As we interact with the society, those abilities developed, enhanced, and progressed. All right, is there any relationship between eyewitness testimony and attention? That's another important point showing the dynamics of attention, limitation of attention. Let's consider an accident. That's what the picture is depicting. There is an intersection, an accident is occurring, and let's say we have some eyewitnesses, eyewitness number 1, number 2, number 3, number 4. And after the accident, police will come and ask the eyewitnesses, what happened? Tell me. And what the police reports, that they are getting 4 different scenarios from 4 different eyewitnesses. Why? Because there are a number of individual factors, personal factors, such as, remember, attention is limited, so therefore each of these eyewitnesses are probably paying attention to something else. And when they are paying attention to something, remember, we cannot totally focus at something else. So therefore they are only solely talking about what they have catched on the accident. Second one, attention is selective. So maybe they selectively attend to some part of the stimulus. The stimulus is the accident in this case. Also, can stress and anxiety factor in here? Absolutely. The studies show that stress and anxiety plays a role on attention. And these people, these eyewitnesses, are subjected to stress and anxiety during the time of the accident, right? So that stress and anxiety, we know, elevated level of stress and anxiety reduces the cognitive capacities, such as attention. So therefore, these people probably momentarily experienced attention deficit. Also, weapon focus. That's another term that we consider in criminology, actually, but that is something related to attention also. Imagine a crime scene. You are a witness of a crime scene, or maybe you are a victim of a crime scene, of a crime. And imagine in that crime there is a weapon. Where will your full attention be focused? Absolutely. It will focus on the weapon, nowhere else. Your survival mechanisms are intact. So you will pay attention to something that threatens you. And your full attention will be on the weapon. So therefore, remember, attention is limited. When we pay full attention to something, we ignore the other things. So after that, the police comes and police asks your testimony. How was the perpetrator look like? And people cannot say anything about the image of the perpetrator. What was he wearing or what was she wearing? Nothing. They don't even remember a color of their shirt or jacket. Was he wearing a watch? Nothing. They don't remember because they didn't attend to those stimuli. What they attend was the weapon, and in fact, they can give full detailed information about the weapon on the side that was used. So, therefore, weapon focus, stress and anxiety are depriving our attention skills. Can attention be influenced by certain stimuli, such as culture, society? Time plays a role. That's why I use technology. As time progresses, technology changes, and we change our focus of attention to something else progressively. Stimulants, depressants, these are the substance abuse, right? Some of the classes of drugs that people abuse, can that alter attention? Culture and society, absolutely. People use cognitive mechanisms to interact during socialization process. Yes, let's give an example. We are on a party and you are introduced to someone for the first time. The name is given to you and then you like this person, so you spend most of the night with this person. You had a good night, you exchange few words, you had a quality of time with this person. And let's say the next day you met with this person on the street. Would you remember the name? That's what happens usually. We don't remember the names. Even though the name is given to us when we are introduced to someone for the first time, that information goes out of the window. However, we have a good recollection of the face. We can recognize the face because we attend to the face. We have a certain brain area that is responsible for face recognition. Why? Because that area attends to the face, facial information, facial features. However, we don't have, as far as I know, we don't have any specific brain area responsible for name recognition. So cognitive mechanisms are important in socialization. We use all of them. Not only attention, but all of them. So culture, we are in culture. You remember we talked about the time. As time lapses, people are changing. So look at these people. Before, I will say up to 20 years ago, when people sat on a family table, they would interact to each other. That's what we experienced up until 20 years ago. But if you notice, technology advanced rapidly with the advancement of the smartphones, for example, tablets, computers, right? Those things. So, and we became more individualistic. So when we sat on a family table, of course, I am not saying this is happening in every family, of course not, but however, especially the families in the city life changed dramatically. And instead of paying attention, focusing their attention on each other to make interaction, they changed their focus of attention to these devices. And actually, the human interaction, the socialization is reduced. Remember, what did we say for the development of cognitive resources? Socialization. Interaction with the environment is important. So, what this may say, I think you got the answer. And if we continue like this, our cognitive abilities might be reduced. Well, we see the similar things in all aspects of life. Of course, this is an extreme example. I have never seen something like this, but I have seen similar things, and even I do the same thing. When we sit on a table, instead of focusing on each other, instead of communicating, we choose to communicate with this piece of device. I don't know why. It is shaped. Culture is shaped, therefore our focus of attention is shaped. And even children are doing the same thing. As far as I learned, the cell phone age for children is 12. On one hand, it is something good. In time like this, yes, children has to call their parents to report where they are. In that sense, it is good. However, nobody is using for that. That's one thing and finished. Report where you are and that's it. You don't have to report anything until the next hour. But what will happen within those 1 hour period? All things can happen. Instead of socializing with each other, they socialize with this piece of device. Okay, substance abuse. So we mentioned about the culture and time, how culture and time changed our focus of attention, and let's come back to something totally different. Can substance abuse, drug addiction, in other words, here we are talking about illicit drugs that are sold on the street, right? Can they alter attention? Absolutely, yes. For example, we experience alertness under the influence of stimulants, such as amphetamine. Caffeine is a stimulant too, but we do not consider it as a substance. However, it's a stimulant, I have to say. But we are talking about illicit drugs here. So methamphetamine, amphetamine, these are strong stimulants and they alter our alertness. How? They increase the efficiency of the nervous system. Nervous system should work at an optimum level. There is an optimum level for the nervous system to work. If the nervous system is working higher than the optimum level, we will experience attention deficit. In other words, we will try to pay attention to multiple things at one time, and it will not occur. So therefore, we will experience attention deficit. On the other hand, we experience decreased alertness under the influence of a depressant, such as alcohol. Alcohol is probably the most abused depressant. What it does is, it doesn't make you depressed. We call it depressant because it reduces the efficiency of the nervous system. So nervous system does not work in the optimum level again. It is working below the optimum level. That is also not good for our cognition, for our neural communication, and also for our attention. So with the depressants, what goes out of the window? The reflexes, for example. So when the person is driving a car, the reflexes will not work in a healthy way. So at the same time, this person won't be able to attend to relevant stimulus, such as the road, such as the signs on the road, right? Such as red light, green light, those things. This person won't be able to attend in a healthy way, so that this person may cause an accident. That's why we say that substances in general, can cause altered state of consciousness and influence our attention negatively. Here we talked about two classes of substances. There are a number of different classes of substances that can alter cognition.